It's been described as the worst medical treatment disaster in the NHS's history. During the 1970s and 80s, sufferers of haemophilia were infected with the HIV virus and hepatitis C when they received contaminated blood transfusions.
Campaigners say nearly 3,000 people have died as a result, and today victims and their families marched to Downing Street to call for more compensation from the government and recognition of the mistakes that were made. Our correspondent Chris Perry was there.
Hayden Lewis from Cardiff died from liver cancer in May after contracting hepatitis C. He was also living with HIV. He also had to live with the fact that the illnesses which killed him were forced upon him after a medical blunder. Today, hundreds marched in his memory and for all of those who died or are still suffering after haemophiliacs were given blood by the NHS during the 70s and 80s that had been sourced from abroad and wasn't properly screened.
It is the worst treatment disaster in the history of the National Health Service. 1,974 people with haemophilia died from infection.
The Sugar family from Bather near Pontypridd are mourning the loss of a loved one just 3 weeks ago. After a horse riding accident when he was 14, haemophiliac Lee Sugar was given an infected blood transfusion. A few years later, he was diagnosed with hepatitis C, which eventually killed him.
And we want recognition of the fact that that fault is in their hands and compensation for the victims of this and the dependents that rely on them. Victims
say that under guidelines put in place by the last government after a privately funded inquiry, they either don't qualify for compensation or receive too small a sum to live on. The victims and their families blame the last Conservative government for what they call a haemophilia holocaust, and they're now demanding that this Conservative Lib Dem coalition rights those wrongs. In a statement, the Department of Health said health ministers are currently considering future policy in relation to those affected by contaminated blood, and representatives will be invited to discuss key issues of concern as soon as possible. The protesters hope that after meeting with MPs in Westminster, a new law will be supported that will give victims increased compensation and recognition of the suffering they've endured for nearly 3 decades. Chris Perry, Wales Tonight, Westminster.